Hello, my name is Dr. Asley. I'm a board-certified fellowship-trained spine surgeon, and I'm the medical director here in Spine Treatment Center. In this segment, I'll be discussing with you a surgery called X-stop procedure. Before we do that, let me tell you a condition called spinal stenosis. I've already covered this in the pathology of the spine conditions, but let me just brush up on that. As you can see, the bones are connected to each other through this cartilage called disc. As we get older, the disc deteriorates, wear and tear. When we are young, the disc is nice and plump and plush, like a juicy fruit. As we get older, the fruit gets a little bit slowly dry over time. And what happens is that when the disc starts getting drier and getting a little bit weaker, it starts settling like that, exactly like that. As the disc settles, it becomes loose. As it gets loose, body tries to stabilize itself by forming osteophytes and more bone formation, exuberant bone formation. If the bones grow anteriorly, not a big deal, but if the bone grows into the back, into the neural canal where all the nerves are, then that's a problem. The second and the third things that happens is that as the disc deteriorates and it settles, the facet joints that we see right here, these gliding joints, start getting arthritic and they get big. As they get big, they start growing into the spinal canal as well. The third thing that happens is that as the disc deteriorates and it settles, these tight ligaments right here between the two bones, right in that section, we call them yellow ligament, right there, they start infolding like a curtain coming down. As the vertebrae settle, they start infolding into the spinal canal. And therefore, what happens is that overall, the size of the canal where the nerves are, they get smaller, get pinched circumferentially from the front with the osteophytes, and mostly from the back with the yellow ligament start infolding. Now, the typical sign of this problem is that if patient is walking and start getting back and leg pain, and when they lean forward, they feel better. Why? Because when they lean forward, as you can see right here, the distance between the two bones increases, and that ligament that's infolded gets pulled back, and that releases the space in the spinal canal. Now, if the patient comes to me and says, we have this back pain that starts with walking, turns into buttock pain, radiates down our legs, either right or left or both, and when we lean forward, you feel better, and I get MRIs and I see, yes, the nerves are getting pinched and the yellow ligament kind of pinches into the canal. Then we can do a surgery called X-stop. What X-stop is a prosthesis about the size of the tip of this pen, almost the same size, that size, and it's titanium. And what happens is that we put this cage between the two bones, very small surgery, incision about this long, right where the problem is. Let's say because we have the spinous process intact in this model right here, let's discuss this part. Incision is about this one over the spinous processes. You go down, you take the muscle off the bone, and you're looking right down into that space. And you put a bullet-shaped prosthesis made out of titanium between the two bones to open them up. And as you open up, the ligament gets pulled back. The way I explain to my patients is that when they lean forward, they feel better because this opens up. And with putting the bullet right there is that when they stand up, that one segment stays open. And that's what the surgery is. Now, of course, the problem could happen is that within the next few years, because the bone can settle on this prosthesis and pain can return. And if that happens, then we can go and revise it. But even if you get 2 years, a year or 2 years of good pain relief from the surgery, that is worth it.